And this is Joe. Welcome back to the 2B podcast.
That's right. We're two Black educators living in Boston, seeking Black excellence, and literally all things Black excellence. Tell them some more, Joe.
All things Black excellence. And today we are specifically seeking Black excellence in the form of our essential workers. Okay, so when we think essential workers, we're talking about food. We're talking about food delivery, not just your grocery. How many of y'all have been ordering Uber? Don't play. Don't play. They risking their lives, right? We're talking about postal workers. How many of y'all been ordering still on Amazon? You need to cut it. All right. But right. But those people delivering your mail, delivering your Amazon packages, until you switch to Black businesses. Actually, shameless. You want to plug that company? That shirt is dope.
Listen, I have to, because let me just shout out the other Boston. So if you're watching right now, you can see it. Got that on the screen. They sent me this really, really cool shirt. Since we are repping Boston, Roxbury and Dorchester and Mattapan and Hyde Park, right?
Hey!
And even though I'm not from Boston, I live in this area now. I teach in Roxbury, so I'm repping too. And one of the things we've talked about, right, is for us to really start feeling like the community is ours. We talked about There's a movement to buy back the block. Don't move away. Buy the block. Especially buy the block that you own, that you rent, because the more that you own in it, the more that you have in terms of the ability to make decisions, to make changes, to make the block into what you want it to be.
Absolutely. And so continuing with our essentials workers list, you cannot forget the people who have been at the forefront of this, our healthcare professionals. So later today, we will be having the melanin nurses. So they Black and beautiful. They got brains and beauty, and they're out there making sure that they are keeping us healthy as well in the hospitals. So we are going to have them on the show as well. Right. So yes, Black excellence in every facet, every way.
And this really goes back to a conversation we had a couple episodes ago where I talked about, and I know a couple people were upset. They said I was a dream killer, but I talked about how we have to, as a community, really push our young people, right, in certain directions, into certain fields like healthcare, like education, like law, because we need more of us in those fields if we're really going to make change. It's one thing to ask, white people to make a change for us. It's another thing for us to be in the room, have a seat at the table, and then be able to demand that we make changes that benefit our community. So I'm excited about having the melanin nurses on later, because we have to talk. We have to talk. Pull up.
Yes, exactly. And so before we get into that, I think that, we kind of sometimes get bogged down, but what is it like to find and feel joy in the midst of so much despair and uncertainty?
Wow. How could I not, right? Because it's just yesterday, my wife and I announced that we are having a baby. So
he's gonna be a daddy. He's gonna be a daddy. Daddy yummy. Daddy yummy. Daddy yummy. Is it daddy? Daddy. No. I'm so excited. Sorry.
I can tell. Thank you, Auntie Joe. Listen, but I say that to say that 2020. I just finished saying this before we got on. Has been really a hell of a year. So much craziness, so much hatred has been put out into the world, and it continues to be spread. But at the same time, just like our brothers over at the Teachers Lounge presented us, last Friday, the Friday before last, with the joyful resistance. I think it's important that we spread joy. And moments like this, the birth of a child, folks graduating from high school, from college, all of those moments, those milestone occasions, it's important that we really take a moment, right, to not only shout them out, celebrate ourselves, celebrate others. These accomplishments, they're really what's pushing us, right? Because there are days, we've talked about it, where it's just heavy. The heaviness is in the air because of how much we're dealing with in the midst of trying to make changes, in the midst of trying to fight racial oppression, racial inequalities, racism, in every facet, literally in every facet of America and in the world. So it's important that we take time to really acknowledge those things. What about you, Joe? How do you bring about joy?
Agreed. Any moment to celebrate is something that we should be holding on to. I think like a lot of people are like, oh, do I feel guilty about feeling joy? Absolutely not. Absolutely not. Rejuvenate your soul, rejuvenate your body by living in that joy for as long as you can because you deserve it. The idea that you don't deserve to feel joy just because there is sadness, I wouldn't say is a valid logical argument. We deserve to feel and sit in that happiness and share in that happiness because the truth is, I feel like a lot of us are looking for it. So I know hearing about the fact that you will be bringing in a child brought me so much joy that I get to sit in it because I know we've had conversations. We've known each other a couple years now, and this has been something that you have known was you wanted in your life. And so to know that this is a crazy time, and yes, there is death, but there's also new life coming to parents who I know are going to bring about a contributing member of society. And I'm thrilled. I'm thrilled. And that's the thing. With you being happy, passing the happiness, and we now get to share that happiness with our listeners, that is a resistance. That is a form of fight, a form of how we can keep ourselves going, an ability to recharge. And I don't know about you, but I need to recharge every once in a while. And feeling joy and happiness is one of the best ways I believe that we can do this. And if we can support one another in that, even better.
Right. Most definitely.
So congratulations.
Thank you. Thank you. Thank you.
And feel that joy. Feel that joy. Don't let nobody steal your joy. Nobody. So without further ado, we're going to jump right in because we have so many questions for our guests, right? Like, I bet y'all have so many questions. Remember to put them in the chat because they're here. If you didn't have nurses in your family and you weren't talking to them, make sure you're asking our melanin nurses, right? They are Nurse Camilla B and Nurse Toni B, two best friends that came together to create the Melanin Nurses. They were both born and raised in Boston. So we reppin'. And actually, we happen to know that they come from Roxbury and Dorchester. We reppin', right? They work at a major Boston hospital as med-surg nurses, medical surgical nurses, med-surg for short. They created Melanin Nurses because they saw a need to highlight Black nurses. Because like Ty said, they understand that there's discrimination and there is underrepresentation of Blackness within the nursing field. So the Melanin Nurses are dedicated to highlighting the achievements of Black nurses, motivating more into the field, and building connection and creating opportunities because representation matters. Please welcome the Melanin Nurses. Hello.
Hello, ladies. Thank you for joining us.
Thank you so much for having us. We really appreciate this opportunity. I'm Camilla.
I'm Toni.
And we're the Melanin Nurses.
In unison, okay. Before we go any further, I really want to just acknowledge the fact that you guys saw a need, right, to highlight Black nurses, and then you took action. And I think that that's really important because we're at a time and place now where sometimes people see a need, they think of something, and then maybe they don't feel like they're the person that can solve that problem, or maybe they're not the one to lead this charge. But you guys took action. You say, you know what, we see there's a void here. We're going to do something about it. So that's critical. I think that can't be acknowledged enough.
Thank you so much. We really appreciate it.
Thank you guys for having us.
Absolutely. Thank you for the work that you do. So will you tell us about yourselves, please? How did you get into nursing? How long have you been doing it? Introduce yourselves.
So our stories are pretty much very similar. So I applied to nursing school straight out of high school. And then I was in the nursing program for about a year. And I didn't really succeed in it just from the transition from high school to college. I went to Boston College. It just was very difficult and just dealing with home issues. So then I switched to psychology. I learned a lot about myself doing that. And then I just was like, nursing is actually what I wanted to do. So I, pursued nursing again, and I'm here now. And
perseverance.
Yes.
So mine is similar, like she said. From high school, I went into nursing school for like maybe a semester or a little over a semester. It really wasn't. I felt like it wasn't what I wanted to do, so I switched to biology. Then I went to psychology.
Mm-hmm.
After that, I went to nurse my grandmother. She had breast cancer, and I found myself helping her and taking care of her. So I realized nursing is what I really wanted to do, like caring for others and just being there and nurturing them. And then graduated my nursing degree, and then we started working at a Boston City Hospital.
Okay.
That is amazing. And I want to thank you for highlighting that it wasn't a straight shot.
Yeah, no, it definitely was not. Oh my God.
No, it was not at all.
At all.
It was a lot of learning. It was a lot of learning about ourselves and what we wanted to do. So,
yeah. Agreed. So thank you for that, because I think sometimes people are like, oh, they just talk about the result. They don't talk about the path to get there. And it's okay that you started, you stopped, and then you went back. You found yourselves and you went back. So that is amazing.
Yes, that's a story I always feel like I need to tell people, because people feel like, just because they failed in something that they shouldn't keep going. And I just remember being so scared when I was like, oh, I'm going to do nursing again. I was terrified. Like, I was having nightmares at night. Like, what if I fail again?
Yeah.
But I just said, like, I just have to do it, so.
It's important to share this with others, because I remember being here for her and encouraging her and letting her know it's okay. Like, if you're not doing well, you're not gonna always do well. So it's good to share this to let people know that it's not always a straight shot and it's not always gonna be easy. So
100%. So what you don't know is you'll this partnership might continue to our medical program at Madison Park Technical Vocational High School. I think some of our students could benefit from hearing your story.
Absolutely.
I'd love to do that.
For sure.
All right, then.
Sure.
You heard it live. They're coming. Stay recruiting. So the topic of the hour, COVID, this pandemic.
Yes.
And so just tell us, one day the hospital looks like this, COVID happens, and how does the hospital transform? What is the response that the hospital, what does it look like? How is your working environment different now?
Oh, it drastically changed. Like, we had our whole floor changed into COVID floor. So many other floors were COVID floors. There weren't visitors coming in. Policies were changing every day, sometimes multiple times a day. And, it just was like a scary time, because nobody knew like how to respond to this. And, we're looking at what's going on in Italy and then seeing what's happening in New York. So it's a very, very stressful time for all of us. But, we were very, very thankful, because we had a lot of support from educators and just even from doctors, and just doing things that they don't normally do. Like, oh, I'm about to go in this patient's room. Do you need me to bring something in there? Just to, because we didn't want to go in a room so much. So that was definitely, something that was beautiful about the situation, even though it was very scary.
It was just more so like every day you walked into work, you just did not know what you were walking into. Like, one day this policy was this way. The next day it's like, oh, we're not doing that anymore. We need to do this. So it was, you just had to go in with an open mind and just be like, okay, so what's new today? And
For sure.
that's what it was. And I feel like Camilla said, it brought us together. It brought us together, and it made us realize the importance of supporting one another, teamwork, and just being there for one another, because at the end of the day, we're in this together.
Absolutely. That brings me to another point, because you talked about supporting each other and recognizing that we're in this together. I think that has been a point that hopefully all of America, all Americans really understand. Some are still struggling with that because they're deciding not to wear their masks, which is idiotic. We won't get into that. But let me ask you this, because I really feel that in America, we need to treat our healthcare professionals with care, right? If we expect you to be able to care for other individuals, then you have to feel cared for. and many of us heard about, read about, saw that there were shortages with respirators, but more importantly with PPE, with protective equipment for you. So were you guys affected by the shortage of personal protective equipment? Did you have to reuse your equipment? What did that situation look like?
Yes, so we were definitely affected by that. Just for the simple fact that like there just wasn't enough. But the great thing about it is that we did get a lot of donations from like around the world and just from different people.
Celebrities from Boston definitely came and donated to the hospitals.
Okay.
You know, it was a shortage for everyone, but I think it was because everyone was not expecting this.
Mm-hmm.
But I feel like people in the community acted very rapidly to get us what we needed, and we're very thankful for that.
Even like my family and friends, like people will call me and be like, "Oh, I just see these masks at the store. I'm gonna grab them for you."
Right.
Or people would like random people like that I just have on as friends on Facebook that I don't really know like that. They'll just tag me and be like, "Oh, this person's selling masks," or so like it just was. I don't know. I just really loved that part about it, like just seeing how people were really there for me and really just wanted to make sure that I was protected.
People, a lot of people are coming through that you wouldn't have expected just because they knew that we were on the line and they wanted us to stay safe. So
that is amazing. And again, just like, yes, there are times when crisis happens that we really do come together, even if it's just in certain pockets. So it's beautiful to hear that the community came together to support the nursing professionals, and you felt supported. But did the PPE, and actually, can you talk about, I think we've all seen like videos about putting on all those layers and trying to communicate with the patient through these layers. Can you first and foremost tell us about that? And if it really made you feel safe, even going through all of that?
No, it was still very much so scary. Like, cause you're just like, am I putting it on right? Am I taking it off like correctly as well? Like, I don't know. I just was so terrified. And I just remember putting on so many masks on my face and I just couldn't breathe. And I'm just like, I know I probably look ridiculous, but I'm like, I just want to make sure I do not breathe this in. So, and then just having difficulty communicating with patients, especially patients who are deaf and they need to see your mouth moving in order to understand what you're saying. So that definitely was difficult. For sure.
And another thing was difficult was because things were changing so rapidly with the CDC. They were saying, you don't need an N95. You just need a regular mask. I remember all the time, like, wondering, like, I wonder if this really is even working. Like, is this even really protecting us? Like, the next thing tomorrow. So that was always going through my mind. And like Camilla said, just communicating, like, you just don't know. I like facial expressions, everything, body language is part of communication. So if your face is covered, you don't know exactly what the person is saying or like their what place were they coming from. Like it just was a lot. It was a lot.
Yeah, and also just thinking about the patients, like we're coming in the room with all this stuff on, like that would be scary for me as a patient. Like, who are you? Like, what do you look like? Are you smiling? Are you happy? Like what's going on behind all the stuff that you have on? So just got to think of it from that standpoint as well.
I definitely understand what you mean with that, because I think that even as we go out, and especially about a month or two ago, when things really start to reopen, and you would see some folks that have, a tremendous amount of PPE on. They've got a mask, they've got a shield, they've got gloves. I saw one person that looked like they were in a hazmat suit in Costco. So, it's on one hand, it's like, okay, they're taking a lot of safety measures. On the other hand, it makes you wonder, maybe they have been infected. Maybe they're trying to protect themselves from infecting others. You never know. So it's a difficult experience to see folks in all that PPE. And at the end of the day, you really just have to take the right measures to stay safe.
Yeah. You said gloves, so I just want to address that real quick. People have got to stop wearing gloves in public. Yeah. You just have to stop doing that.
It causes cross-contamination. Like you're touching the doorknob that millions of people have touched, and then you're going to touch an apple, and then you're going to touch meat, salmonella poisoning. it causes cross contamination. So
yes, COVID is not going to infuse through your hands.
Right.
Just wash your hands and use hand sanitizer when you can't wash it.
But
start with the gloves everywhere.
The bacteria and the infection does stay on surfaces. So if you're touching a doorknob and it's on that surface, and you have those gloves on, and you go shake your friend's hand or touch a package of meat in the supermarket, it just might be on that.
So no more gloves.
Hands.
Yeah, it's unnecessary. Unless you're literally touching something that's soiled, but just like walking around with the gloves, like thinking like, oh, I'm protected. If you touch something dirty and then you pick up your phone and you put it to your face, it's literally like your same dirty hand. You know what I mean? People think like, oh, I have this glove on and everything's going to be okay. And it's like, no. That's a replacement. They think that's a replacement for washing their hands. And it's like, no, it's not going to infuse through your hands. So just make sure you wash your hands and carry hand sanitizer.
I'm not going to lie. Thank you. Thank you for educating the populace, because I think that in an effort to be safe, people aren't even thinking about the fact that, well, if I touch and then I touch and then I touch, like, well, you just kept the germs spreading. Like it didn't make a difference. So thank you for that reminder. Thank you for that reminder. So Toni, if I'm correct, you have some news too.
Yes, I am expecting. I will girl.
Congratulations.
October. So I'm very excited about that. Something positive coming out of this whole
chaos.
Yes.
So as a pregnant woman, and with the minimal amount of research that there is with COVID-19 being the new virus that it is, and so we don't know how it affects the fetus. Like, how were you feeling in the hospital?
I was really, really nervous. There was a lot of fear of what, like you said, of fear of what we don't know. It was more so of like I said, every time I put my PPE on, I just didn't know, was this really protecting me? How is this going? If I contract the virus, how is this going to affect my child? And then not only that, it's just more so like their prenatal care was very limited. So it's like if something happens to me, like they're telling me I need to do a phone. I need to, talk to my midwife or my doctor on the phone. And it's very different. So it was more so I just felt like I needed to do whatever it was to limit my exposure. I actually put my hours down. Like I wasn't working as much as I wanted to and needed to, but it was more so for my safety. And it's very nerve-wracking. And I just tried to do whatever it was to protect me and my child, which was priority number one. And also the people around me. But yeah.
Of course. Let me ask this question, and I think that it's something that I would imagine would have crossed your mind. And for some folks, they don't have this as an option, but that doesn't mean that we don't have this thought. For either of you, during this time and still in this moment, have you considered stepping away from nursing, at least for a brief amount of time until the numbers of, the coronavirus numbers were a little bit more regulated or they decreased to a certain level? Did you ever consider maybe right now is not the best time?
No, not me.
Yeah.
No.
It wasn't like I never wanted to stop. It was more so I just needed to decrease my exposure, my exposure to what was going on because it was so much. But it was never so much that like just stop going to work and just not go. Just more so decreasing exposure because at first it was more so like, I wanted to protect myself, but I felt so bad for the community, and it was a reason I decided to work in my community. So I wanted to always help.
Right.
At the same time, it's kind of like you're stuck between helping and then protecting yourself. So
right.
For me, I actually felt empowered by working with these COVID patients. I just was like, I felt like I was a part of history. So I definitely didn't think about not doing it, but it was just more so scary. Like, am I being protected? Am I being supported? So those are the kind of things that I worried about, but definitely not stepping away from it. And I am so thankful that I was able to be a part of it because I just feel like it made me look at life differently. I had patients who were dying, and you know, their family not being able to be there for them. And I just, you know, we had to decrease the exposure going into the room. But, you know, sometimes I would, for this one particular patient, I just would like go in the room and just hold her hand, like, even though she wasn't aware of what was going on, but just like, you know, just to let her know that, you know, someone's here for her. Yeah. So that definitely was like one of the most heartbreaking things for me, seeing that people's family couldn't be there for them while they were like battling this really crazy disease. So.
And to just branch off of that, like, when you're working, sometimes not even just in the medical field, but just like maybe in the, like business, people become numbers. And it really made me also think like, you know, this is a human. You know what I mean? Like she said, they were not there with their family. We were the people that they're seeing every single day. So it was very important for us to have that connection and to really make them feel comfortable, let them know that we're trying our best. We're here with you, and we're gonna, you know, continue to be here with you.
Yo, I love me some nurses. Oh, like, oh my goodness, goodness.
There's
like,
so many parallels to what they just said, right? So our field of education to the healthcare field, so many parallels. Especially what you said about people becoming numbers. Same thing with our students; they become numbers and not humans, and the outcomes are reflected. You know, in terms of the way in which we approach the situation based on the fact that they're just numbers and not people, then their outcomes are negatively affected. Now, I really thank both of you for taking on this charge, because you both talked about wanting to work in your community, number one, and number two, during this time, you're balancing protecting yourself and caring for others, and you're in a position where you're not always thanked, right? I'm sure that you're dealing with colleagues and coworkers that may or may not be as kind and as gentle as they should be during this time. And I wanted to ask you guys a question, right? So while you're at the hospital, and I don't want anybody to get in trouble, but I'm thinking about there was a nurse that came on the Breakfast Club a few months ago. I forget her name. I think it was Melissa from New York, I believe. And she talked about how at her hospital, she quit on IG Live because she felt like she was not being supported, right? I don't know if you guys heard that. And she talked about how her manager did not inform her that she was dealing with patients that were COVID-19 positive. I believe she had an underlying issue. I think she was a survivor of breast cancer. So she should have not been assigned to those patients. Were you guys in situations where you felt like your employer did not support you?
No, I feel like our employer did a pretty good job with that. So like people who were pregnant or who had pre-existing conditions, they can, you know, they didn't have to work with the COVID patients. So I think they did a really good job with that. So I'm definitely proud of like my hospital for that, for sure.
They gave us the option, like they said, you can stay or you can go. It's up to you, which I really thought was a good idea. But we definitely had the support. We definitely had the support, and we're very thankful for that, because that's a hard decision. That's a really hard decision. And I think our hospital was very understanding of that, and just being there and giving us that option.
And for me, since I work with the COVID patients, and I had a family member who's immunocompromised as well as young kids, my hospital actually put me in a hotel for 5 weeks. So that was, you know, definitely amazing to not have to be at home and worry about exposing my family members. So I can't even be more thankful for that.
Yeah.
Wow.
Yeah.
Wow.
Those are the type of measures that should be taken everywhere.
Yes.
For sure. For sure.
Oh my goodness. Wow. That is such a blessing, because I was really thinking, you know, how do you come home, you know, knowing that, well, I've just been working with COVID patients. And the truth is, so one day they're COVID and one day they're not COVID, and then one day they're COVID. And it's like,
that was a very scary part.
Yeah, that was definitely scary.
Right. That's something.
She worked with the COVID patients, and then I worked with patients who came in for other severe issues. So they would come in and be like, oh, no, we're working up for one disease. And then the next day you're like, we're sending them to the COVID unit. So it was a little scary, but it's because we just didn't know. There was so much unknown. So. Right.
I mean, literally, you're going into work every day, walking into the great unknown, right? And that uncertainty, I mean, that's got to eat away at you. And as you mentioned, Toni, the flow of patients from one floor to one department to the next because of their progressing issues, I can't really imagine working in that situation, to be quite honest.
Yeah.
Yes.
There was actually nurses who decided that, you know, they had their health issues, and they decided that they wanted to work with the COVID patients, because working with the COVID patients, they had all the correct PPE and they knew what they were dealing with. Whereas if you're dealing with somebody who has like another disease or ailment, and you don't have all the PPE that you would if they had COVID, but then you and you're like, wait, I'm just exposed. So some people just decided, like, I'm just going to work with the COVID patients because I know exactly what I'm dealing with and I'm going to be protected. So,
that's another way to look at it.
Yeah, actually, that's so smart, because Toni, you were just saying, like, and then I came back and they're like, actually, we're moving him to the COVID floor. And you're like, wait, wait a second here. Nurse Miilah, you started talking about patients dying alone. And I first and foremost, again, want to reiterate something that Ty said about you seeing their humanness. And I want to thank you, nurses, for doing that, because when you're in the hospital, you're going through some of the toughest things like you can be going through. And then now you are doing it in isolation. And I know when I ask people, like, oh, what are your fears? A lot of them are like dying alone. And here we are, in order to protect their family members, they cannot come and be with their loved one. And sometimes, yes, they're dying alone, or fortunately with the hand of a nurse who's there to be with them. How did you help patients feel not alone?
As I mentioned before, like, I would just go in the room and, like, you know, just hold their hands, or like we'll call into the room and ask them, like, what do they need? Because, you know, we wanted to limit the amount of times we went in the room, but sometimes I would just go in anyway. In some rooms they had like open windows, so we'll just like leave the curtains open, just so, you know, and just like wave or whatever as we walk by. So yeah, that's just some of the things that I did, and just really just try to talk to them and, you know, get to know them. And I think that's important. When you try to get to know somebody, they definitely see that you care about who they are. So.
And what about the family? Was there any, like, how did you, from the outside in, bring in the family, if that makes sense?
So I didn't really deal with the iPads, but the doctors will like talk to the family with the iPads for the patients. And sometimes I would just make sure that I made time to call the family and update them about what's going on with their loved one. So
that's beautiful.
Yeah,
it's important.
It's important.
Oh, I thought you were going to say something. I'm sorry.
Like, some patients,
we're both so respectful that we're like, oh, you're talking. Oh, you're talking.
But I also like, go ahead.
Like the patients, they would come in with just their cell phones. I feel like from just the beginning of COVID, we have a lot of like chargers for the patients to use.
Yeah.
Just because that's very, very important. So sometimes I found myself spending a lot of time working with the patients in their phone, just so they can communicate with their family members at home and stuff, and just being on social media and feeling like they're still connected with the world, even though they're like isolated. Like everyone was isolated.
Yeah, for sure.
I really think it's crucial that we take note of the fact that you guys were leading with your heart, right? I mean, Miilah, you just talked about you went into rooms even when necessarily you shouldn't have, but your heart led you into that room because you felt like, I've got to do something to lift this person's spirit. Being in there by themselves, that's one of my fears, is to be in a position where I'm dying alone. And Toni, to the point that you brought up about, you know, being with child, one of the things that has been difficult for me during this period is that as my wife has gone to a few ultrasounds, I've had to sit in the parking lot and FaceTime. So I'm not even in there for that moment to really, you know, start to build that connection with my child. And I can only imagine that I'm in a hospital room or my wife's in a hospital room and I can't be there to support them. I think some of the most heartwarming visuals that we've seen from this time is patients that were happen to be on the first floor and that their family members could see them from the window, or some hospitals set up rooms for patients that were able to leave their room where they had maybe full glass and they could see their family members on the outside, or all the FaceTime calls that you guys just mentioned with nurses facilitating that through families. Those are the important moments. I think that, again, it's a thankless job because you don't always get that thank you at the end of it, but those are the moments that you remember, especially in tough times.
Mm-hmm. Yes, definitely, for sure. Mm-hmm.
And I feel like nursing is so ethical. Like your ethics are being questioned all the time, as well as doctors. And something I'm thinking about is we heard about basically the vent equals death, right? And if you're going on the vent, you're probably not getting off. It's not what you want. That's just what the data seem to suggest. Mm-hmm. And I wonder, as nurses, when you are charting and you're talking to the doctors, what happens when it's like there's nothing else we can do, but the family wants to keep them alive? How did that sit with you?
It was definitely hard because I think the issue is like not having that education, but also like loving that person and you don't want to see them go. And then also they're not there, so they don't see how bad that they might be suffering. So yeah, that definitely was like very difficult for us. But I feel like I understood it because, you're thinking about your loved ones and you're like, would I just let them go to, you would fight.
Right.
You will want to see them fight into the end. So yeah,
it's really tough. So just to think about and just to wrap your head around it, even if we're knowing, like, we're educated about the whole process of, informing their family members, but just if the roles were reversed, it's hard. It's hard to let go.
To that point, I really want to add something that Joe and I have talked about on numerous episodes. We even did a 100K in May challenge where we ran 62.1 miles, 100K, as part of our self-care and rejuvenation. But as nurses, and especially during the coronavirus pandemic, I imagine you guys are dealing with quite a bit of loss, with death, with folks just experiencing hardships all around. And I wonder, how have you guys dealt with that? What self-care have you guys implemented to really be able to decompress? Because sometimes we have to give ourselves permission to have humor and joy, even in the face of the dying process. What self-care steps have you guys implemented to be able to sort of leave work at work and then still feel whole when you step outside of your PPE?
Personally, I found myself realizing that when this whole thing started and as it continued to go on, that's all you saw on TV, on your phone. So like I would just like get off of social media. Like I actually like limited my time. Like I put a timer on my phone. So, it'll let me know like, you have 5 more minutes to be on Instagram or something. And then I will just turn it off and I'll just watch a TV show just to kind of get my mind off of it. And just like for my mental health, because it was so draining, mentally draining, and just like going to work and then coming home. And then on top of that, just thinking about the fact, me personally, that I'm helped to bring a life into the world. Like it was so, like the good things, like, looking forward to spending time with my child and like how I want them to grow up, and just focus on things to get my mind off of what's going on in the world. So that was very therapeutic for me personally.
I say for me, it might be a little childish. So like one thing that I always do is like, I always like watch cartoons because I just feel like the world is just like too serious. And even social media, I remember social media just used to be fun. And now it's just like racism and just all these issues that are definitely important. I'm glad they're on there because I've learned a lot through social media. But so yeah, sometimes I just turn to cartoons and just like mindlessly watch that.
And just, you gotta know which one.
I like SpongeBob, Adventure Time. What else? Or like funny shows like Everybody Hates Chris. That's my favorite. Or That 70s Show. So yeah, shows like that. those
It
are my
brings you
shows.
back to your childhood. When
Yeah,
you had no
for sure.
worries.
Yes,
You didn't think
yes,
about anything.
yes.
That's what that was my biggest thing. Like just things that we have no worries.
Mhm.
Right.
And just venting too, like people, that's an important thing to do. Like just venting to your coworkers, to your family members, and just like getting it out. Because I feel like sometimes we keep things so bottled in, and then we just like burst. But I also think I could do better with self-care too. So that's something that I'm learning to do better, even as a nurse.
Right.
I love that y'all said it's just you have to forget about your worries, and that is so important. And you have to vent to your friends. Like we have been saying this, like Ty and I talk and support each other. We also have other people that support us, and it's just so important. Like within our communities, just Black teacher communities, Black nursing communities, like you talk to someone who understands what you are experiencing, because that sense of isolation. Nurse Miilah, you said that you are away from your family, which is awesome because you're keeping them safe, and that's wonderful. But at the same time, now you're by yourself and isolated. So I go from hotel to work. I'm not even in my space. Like I live by myself, but I'm in my space. And I wonder what it would be like to be somewhere else. So it's just like hearing you say that you need to make sure that you connect and vent. Thank you.
Yep.
Thank you for saying that. Thank you for saying that. And actually, you brought up a great point talking about racism being all over and social media not being a place where you can just casually scroll and lose your mind in there, because everything brings you back to reality. And touching on racism, we know it's everywhere, and it's also in the medical field, right? As a Black woman yourself, Toni B, and as a nurse, I'm sure you know the mortality rate, not putting this on you, just saying a fact, is higher. The birth mortality rate for mothers is higher for Black women, right? So often Black people generally are under medicated for pain because we have tough skin, and our nerve endings don't do the same thing that white people's nerve endings do.
And it says it in books. It says it in books
That's
too.
true. It does. It really does.
Yeah.
So like what how this is so scary. We're in a hospital. Ty's actually the one that brought this up. Like, you're in a hospital. There's not even a treatment necessarily for coronavirus. And I know that I tend to be mistreated in hospitals as a Black person. I'm terrified. How do you make me feel comfortable? How do we make sure Black people are getting the treatment that they deserve?
I personally, speaking of that, I seen something this past week about a father who lost his girlfriend and his child during childbirth. They were Black. It made me really think about, like, it's very important to enforce to our people that you need to speak up. One, you need to educate yourself. Whenever something's going on, or just in general on your health, you need to take it serious. You need to educate yourself. You need to. For me being pregnant, I realized you have to listen to your body. You need to listen to your body. And lastly, important, you need to speak up. You need to not let them sit. You need to not let them sit at home. You need to advocate and tell them, like, look, I'm feeling this way. Something needs to be done. Don't send me home. Because you just don't know. You really just do not know, and you need to advocate. Do not, if you feel like this doctor is not doing the right thing, or this specific hospital is just not giving you the care that you need, go to the next one. Because
very important.
Your health is like you're giving up on your health. It's like you're giving up on your life. So educate yourself, and just feel like your wife. You make sure you voice to her. She voices to you what she wants to be, what she wants to be done. If she can't respond, if she can't communicate to the doctors during her labor, make sure you guys have that conversation, because you are her advocate if something happens and she can't respond well. If you have a mother or father, just know what's going on and educate yourself. And educate your family. Like, look, this is what's going on. If something happens to me, advocate for me, tell them I want this done, and just don't give up. Yeah.
Those are so many great points that you just made right there, Toni. And I've been in that same learning process. You know, as my wife is pregnant, we've been fortunate enough to be able to reach out and have a community. She's joined a few Facebook groups of Black mothers, of mothers in general in the area. And as you mentioned, there are certain medical facilities we will not go to because of the experiences of others, especially other Black women who have been to these facilities and had poor experiences, felt like their needs weren't being met, felt like they weren't being listened to. So we know to avoid them because we have to advocate for ourselves, and we have to be knowledgeable, as you mentioned. Something that Joe and I talked about just earlier today is the documentary that my wife and I watched called The Business of Birth, where we read and learned about how there's so many interventions that are brought on by the doctors that are not necessary. That if we would just labor at home and go through the birth as it was naturally intended, because a woman's body was meant to do that, then we would be fine. And that's another part of the problem, not to get on a completely different subject, is there are so many men in the medical field and not enough women in leadership positions that should be able to speak up, especially in regards to childbirth, since that's something that women do and men do not. And I think that's part of the issue.
We, like women, no woman knows their body. Like a woman knows their body better than a man knows their body.
Of course.
We should be the one making the decisions on what's going on. And like you said, we are naturally made to give birth. So all these other interventions before hospitals and all these medications came about, women were naturally just giving birth. That's why I personally choose to go natural, because I don't want anything else controlling my body. Let nature do its course. And these other interventions, human-made things, I'd rather save those for another time.
Right.
Yes, Toni. Yes.
I think to improve Black women's maternal health, we definitely need a multifaceted approach that really addresses Black women's health across the lifespan, improves access to quality care, addresses social determinants of health, and provides greater economic security. I think that's also part of it, is that, you know, we've heard about, I'm sure, that when you go into hospitals, one of the first things they do is they want to know what type of insurance you have. And then based on that insurance, that will then determine what type of care that you receive. And that has to change.
Definitely, for sure.
And thinking about the fact that your insurance is often tied to your job, right? So, you know, do I have quality health insurance anyways? So the healthcare, not to get us all the way off subject for with healthcare, because that is a huge issue as well. But
yes. Honestly, I feel like it all boils down. You need to educate yourself and look at all the alternatives, and don't be so, put all your eggs in one basket. Educate yourself, know what's going on, know your options, and pick the best option for you. Don't feel subjected because of one thing that's going on or what one doctor tells you. Follow your gut, listen to your body, listen to your mind, and go and do what you want to do.
But I also think like there needs to really be some changes. For example, like in nursing school, there needs to be a class on racism in healthcare, or I don't know, maybe that exists somewhere, but I didn't take that class. Not that I really need to, but other people, they absolutely need to take a class on racism in healthcare so they can see the biases that they have and address those before they begin taking care of patients. And just like even being at work, like people see things happen and they don't say anything. Like, you hear other nurses say discriminatory things about patients and you just don't say anything. Like, like we just need to start speaking up. And just from the top to the bottom, like management needs to make it so that when people come forward and report these issues of like racist nurses and doctors, that you don't feel like, you're going to be reprimanded or fired or, something's going to happen to you. So there definitely needs to be like major changes in that in order to save Black people, period.
Because like we stand for, representation matters. If you don't have no one to represent you or know or connect with you, your culture, it's hard to articulate what the type of care that you need. Cultural, differences and just like language barriers. Sometimes it's important. It's really, really important to have someone there to represent you and understand you as a culture, because that affects your health. If you can't articulate or get through to the physician or the nurse how you feel or what you mean, then how are they going to understand your care?
Mm-hmm.
So
Right.
And it can really just be like the littlest thing sometimes. Like I have a story. I used to work on a psych unit, and this one Black little girl, the white professionals, they would tell her that she needs to wash her hair every single day.
Oh,
and of course we know we don't wash our hair every single day. So this girl's hair was so dry and cracked and her like scalp was bleeding. And I had to tell them like, no, we do not wash our hair every single day. And it's like little things like that.
Yeah.
And no, we're not dirty for it either. So don't try me on that either.
Like,
no.
and if I wasn't there, like to educate them on that, like this little girl's, who knows how bad her hair would have gotten. Like, so it's just like little things like that, like proves how, having representation. And it's not saying that like, oh, Black people just need to be taken care of in the hospital by Black people. No, but there needs to be representation so that one, you feel like, there's people here that look like you and that they understand you, but then also these people can, check these other people who don't understand what's going on and educate them. Because, like, it's just so important. Like,
and some of them genuinely just don't know. Like, they don't know. Like, they just don't know. Like, you don't do certain things as a culture. I feel like it's very important, starting from school, to educate. And then once they get into the workforce, it needs to be reinforced because it needs to be, like, you need to know this going into the workforce.
Decolonize the curriculum.
Thank you. Oh my goodness. That doesn't sound just like education. That parallel is so real, because literally we're saying it needs to start in the teachers prep programs. It needs to start in the nursing programs. Whatever school you're in, like you need to be doing the work. Like it is like lives literally are at stake. Lives, I tell you. And I agree so much with every single thing you said, because representation matters, culture matters, feeling welcome, feeling heard, feeling seen. Those things matter. And we forget that emotional health affects us like physically.
In a way, right? The pandemic it's been a tool for exposure, right? We've been able to expose some of the ills of America that many of us knew about, but maybe not to the masses. And this pandemic, COVID-19, it's been an indictment on America's healthcare system, the education system, law enforcement, of course, and America's critical systems. They were leaking, and now it's like they've sprung geysers that are really exposing the inequities, the inefficiencies. And suddenly, like, there's a whole other part of it. We found money for things that we said we didn't have money for. We didn't have money for it, but suddenly now that we need it, we got it. We need to check America's piggy bank, because there's some things some numbers are not adding up. And speaking of America as a whole, I want to ask you guys, in Boston and in Massachusetts in particular, we're in phase 3. I think part 2 of phase 3 of reopening. Some other states have already reopened: Texas, Georgia, California, Florida. Lord have mercy.
Yikes.
And many of them, especially Florida, are seeing increases in positive COVID cases. I know as of yesterday, I read that Florida has 56 ICUs that are at capacity, and another, I want to say 30 of them that are within 10% of capacity due to the increase in COVID-19 cases. So I ask you, as a medical professional, what are your thoughts? What do you think that we should be doing here in Boston? Should we roll back now? Should people just stay indoors, don't go outside? What should we be doing?
I don't know. I feel like we've done a pretty good job. But it is getting scary because people are starting to travel. Like, I know a lot of people who went to Florida and went to Atlanta. And, like, these are these hot spots that are like, the numbers are creeping up. So I really don't really know what the correct answer would be to that. Like, I don't know. It's just scary. That's why I'm just like, I don't want to see those numbers again. Like, I do not want to go through that again.
That was very mentally and physically draining. And like we said, like she said, I don't really know what to do either. I honestly think the governor and, some of the government officials have done a really good job here in Massachusetts with protecting us and just how going about it from the beginning, how they shut everything down. I feel like these states that are experiencing these high numbers later on in this pandemic, still, I feel like Florida, Atlanta, they shut down. They didn't really shut down, or they opened up too early.
Yeah, so, and I think for Atlanta, they didn't even require people to wear masks. So it's like that's something that we required pretty quickly in Massachusetts. So
same in Florida.
What's that like? It's just
and
like,
in Texas.
Yeah.
Yep. Texas too. Yeah.
Oh man! So Neil deGrasse Tyson has this amazing quotation that I love, and Nurse Miilah, you kind of touched on this when you're like, well, some states like now we're traveling, right? And some states never shut down. So he says, having some states open and some states closed is like having a peeing section of a swimming pool.
Yep. Yeah. Yep. Nope. That's exactly what it is. That's exactly what it is.
So then, do you think as a result, we should just prepare ourselves for wave 2?
Yeah. So that's actually a good point. So then, that would be my answer to that.
Get ready. Buckle up.
You didn't leave any room for hope. Yep. No.
Yep. Once you put the peeing analogy, it's just like, okay, yep, that makes sense. Absolutely. For sure. For sure.
Oh, man. Well.
This has been a fruitful conversation, truly empowering. Thank you for providing us with your knowledge about your experience. And I want to say that it's important that we note that there are so many people being affected by this, so many essential workers, the nurses, the doctors, the CNAs, PCTs. I'm missing some folks on that list, right? But they're MAs, but there are so many folks in the healthcare field that are really and truly putting themselves at risk each and every day that they go to work. And then, as we've talked about, it's not just about us, it's about who we come home to, whether it be folks that are immunocompromised, folks that are pregnant, women that are pregnant, I should say, not folks, and just really protecting those people. Joe, what else did you want to say? Because I'm ready to close out. I feel like we did the thing.
Yeah, we did the whole thing, but I just have one more little tiny gripe, just a little one, So I liken, the pandemic to being in like a danger zone, right? Would y'all say like it's kind of dangerous to be working?
Sure.
Yeah. So, when people are in the military and they're deployed, they get extra pay because they themselves are now in a danger zone. So, I mean, I personally think that y'all were in a danger zone. And, we had people on unemployment, rightfully, they need the money, good, getting an extra $600, for hazard pay of not having a job. But what about the hazard pay for having a job and making it so that we can still survive? Essential workers don't go to work.
True.
Yeah.
What happens? How do y'all feel?
I think the whole idea of the whole analogy of you putting like the soldiers going to war, the fact that soldiers go to war, they get a pay for like danger pay. We went to work and we were putting our lives at risk. Our lives were in danger. So it should have been the same thought process. Healthcare professionals should have gotten some type of hazardous pay. Our lives were in danger. Some lives were lost. Some lives were lost. So it's just like, why was there not hazardous pay given to health professionals?
I know, and then it was like, really sad to just see some people's responses like, oh, you signed up for that. So, like, why are you worried about hazard pay? At least you're still working. And it's just like, okay, all right.
Also, did the food workers, the postal workers, did they also sign up for this? Like, the thing is, like, yes, here's the thing. Medical professionals, yes, y'all are amazing. Like you said, you never thought about quitting, right? You were always going to keep going. You're going to do your job. And we thank you for it, right? However, is it not a soldier's job to also, didn't you sign up? Like, if there's a war, you get a war? Like, is it, like, the thing is, special cases even when you are doing your job, you deserve to be compensated. And I think I don't necessarily blame the employers. I blame the government, because I think the government should have assisted in making sure, hey, essential workers, you are literally keeping us going. Here's a little off the top.
Definitely. Definitely.
I think that we have hit the ejection point in this interview. I want to thank you guys, Melanin Nurses, because as we talked about, this has been a long time coming, where we saw your Instagram page months ago. We thought about you guys. We saw you guys out here fighting. And I say fighting because it really is a fight to go to work every day and deal with the coronavirus. And we have to bring you guys on. So I'm really thankful that you were able to get onto the show, and that we were able to highlight you guys for all the work and effort that you're doing in our community and in the healthcare field.
Thank you so much for having us, and I really enjoy your page. I've learned so much listening to you guys, and you guys have such great energy. Like, you just have to be our friends. Like, we have to be friends.
Right. I'm with that.
I want friends. I'm not like Drake out here. I want new friends. I want new friends. Oh my goodness. So I'm going to read a quick quote. This is from a Black woman who is a doctor and an RN, and she is certified in quality risk management specialist. She's amazing. It's Roxy Williams, and she says, to do what nobody else will do, a way that nobody else can do, in spite of what we all go through, that is to be a nurse. So we thank you and honor you for being a nurse.
Thank you.
And so remember to follow us on Facebook, Twitter, Instagram at 2B Podcast.
Yes, and follow us at the Melanin Nurses on Instagram.
Great.
That's right.
Oh, and you can listen to all of our episodes, because we are streaming basically everywhere that podcasts are found, and that never gets old for saying. I'm super excited about that. And in the meantime, remember
To be good to yourself.
to be true to yourself.
To educate yourself. All right.
To educate yourself.
Bye, y'all.
Bye.
Bye.